Anthelmintics and anti-protozoal drugs. uh, Today we'll cover the topics, the drugs which are used in the management and the treatment of the helminthiasis and the infections by the protozoa. Uh, what are the objectives as per our course? List the commonly List the most commonly used anthelmintic drugs. Mention the indications, contraindications, and side effects of the anthelmintic drugs. Then second one is anti-amoebic drug. Classify the anti-amoebic drug according to the site and the mechanism of actions. Mention the mechanism of action, therapeutic uses, and adverse drug reactions of anti-amoebic drug. Describe the pharmacology of drugs used to manage a patient with the diarrhea, and list the condition in which antimicrobial therapy should be considered during the treatment of diarrhea. First, let us clear the term anthelmintic. Anthelmintic terms has many synonyms. Anthelmintics, see the spelling, anthelmintics, or we can also say anti-helminthics. Anti-helminthics or anthelmintics are the group of anti-parasitic drug. These are also called as anti-parasitic, that expel the parasitic worms, that is the helminthes and other internal parasites from the body by their stunning or killing them. So these are the parasitic worms, and the parasitic worms are also termed as helminths. When there is a helminths, these are the worms, and generally they are also called vermifuges or vermicides. The anthelmintic drugs are also called vermifuges or vermicides. So, how many names for anthelmintics we have here? Synonym commonly, anthelmintic are also called anthelmintics or antihelminthics, or we can say it is a group of antiparasitic drug which kills the parasitic worm. We can also say vermifuges, or we can also say vermicides. Wormy means worm, worm. Wormy means worm. Sites means which kills, or fuges means stunning, or can we can say expel from the body. That's why it is termed as vermifuges. According to the name, are worms are the killed or either expelled from the body. So vermifuges, these are the worms which can be expelled by either stunning, so it is vermifuges, or by killing, we can say vermicides. Now you already studied the types of the worms, and these are the nematodes, cystodes, and trematodes. These are the main three types of the worm which are responsible for the helminthiasis. Helminthiasis. Now here, see this term helminths. And infection by this helminth, we can say helminthiasis. Helminthiasis. There is another term, infestation. Instead of infection, here is infestation. And infestation is the state of being invaded by the parasite. When the any condition by the parasite, we can say infestation instead of infection, infestation. So we can say parasitic infestation. Yes, acceptable. So these are the terms which are used for the one condition. As per our objective, list the most commonly used anthelmintic drugs, and here the drugs which are used in the management of the nematode infestation, cystode, which is also termed as tapeworm infestations, and plus trematode infestations are listed here. Now here in the blue line, blue color, please click on the drug name for the further reading. If you click on any drug name, you will be landed to the specific reading page by the Medscape, and you will get the all pharmacology related to the specific drug. Now let us see one by one. Most commonly used anthelmintic drugs here in the nematode infestations. When we say the nematode infections, so it is a group of infection which includes ascariasis, trichuriasis, hookworm, enterobiasis, strongyloiditis, filariasis, and trichinosis. So if the infections occurred by these categories of the parasite, we can say nematode infestations. And the drugs which are used in the treatment of this nematode infestations are albendazole, mebendazole, ivermectin, piperazine, pyrantel pamoate, and diethyl carbazine citrate. These are the drugs which are used in the management of nematode infections, and nematode infection includes ascariasis, trichuriasis, hookworm, enterobiasis, strongyloidiasis, filariasis, trichinosis. If the infection by the cystode infections, and cystode is also termed as tapeworm infestations, this includes Taenia solium, Taenia saginata, Diphyllobothrium, and Hymenolipis. If the infection caused by this parasitic group, we can say cystode or tapeworm infestations. The drugs are include albendazole, praziquantel, paromomycin, niclosamide. Here the spelling PARO, it should be RO. Okay. And the in the trematode infestations, if it is caused by the parasitic group, that is Cystosoma hematobium or Cystosoma mansoni, we can term as it's an the trematode infestations, and the drugs generally used is praziquantel. So if you see in the three groups, the most commonly used drug is praziquantel. Praziquantel available in both cystode and trematode infections. Plus, albendazole is available in nematode and cystode infections. So the most commonly drug albendazole and the praziquantals are commonly used in the parasitic infections. Now, see, if you click on the most commonly used drug, I have make available the further link. You will be landed to the further reading page. Example, suppose we will do here albendazole. Suppose I will click on here albendazole. We will move towards the next window, and it is the by the Medscape. I request and recommend all of you, please make the account, Medscape account, which is free. Just you have to use your email ID and the password. So, what is the benefits of account? If you are using the accounts, you can access more information. Without account, you are not able to access the informations. So here albendazole and its a classic category is anthelmintic. So here if you see in the left side corner, you can get all the available pharmacology, dosing and uses. Uses means indications. When there is a uses, it's an indication. It is an interaction, adverse effect, warning. Warning means we can say contraindications, use in the pregnancy and the lactation. Pharmacology includes the mechanism of action, then pharmacokinetic, absorption, distribution, metabolism, excretion, and there is also some images and the patient handouts are available. So here in the dosing and uses, there are two groups. You can see adult and the pediatrics. So if you click in the pediatrics, you will get the dosage and the use in the pediatrics. And if you click on the adult, you will get the indications and the doses of specific drugs. So this is albendazole, and these are the all the uses. These are the all the uses of albendazole. See, so this type of link are available in all drugs, most of the drugs, the commonly used. Just click, and it is for your further reading. Let us move to the next objective, but be sure that, and please note, the you have to click on the name of the drug, and you will be this PDF is available as a functioning PDF. Just you have to click on the drug name, and you will be get all the pharmacology of drug. So please note that. Next objective is mention the indication, contraindications, and side effects of anthelmintic drugs. Now we will see here the most widely used drugs, albendazole. What is the mechanism of action albendazole? It causes degeneration of cytoplasmic microtubule in the intestinal and tegmental cells of intestinal helminths. It causes degeneration of cytoplasmic microtubule in intestinal and tegmental cells of the intestinal helminthiasis. What are the side effect, or we can say adverse effect? Headache, abdominal pain, dizziness, vertigo, nausea, and the diarrhea. The dose generally it is 400 milligram single dose, and it should be taken as an empty stomach. And what is the benefit if the patient take on empty stomach? It causes intraluminal parasite, and with fatty meal, it increases the absorption of the drug. So the benefits of empty stomach and with the fatty meal is that it is causes the intraluminal parasites, and with fatty meals increases the absorption used against tissue parasite. So if the drug is absorbed morely in the tissue, so it also causes the um, killing of the tissue parasites which are in the tissue. We can say tissue parasite, and causes intraluminal parasite lysis. So 400 milligram single dose. Uh, Contraindications, hypersensitivity. And please take a note, if you have the you ask the question about the contraindications, and if you write the hypersensitivity, yes, hypersensitivity is the universal contraindication for the most of the drug. I will say more than 90% of the drug, yes. So contraindications, hypersensitivity, yes. Liver cirrhosis, pregnancy, and children under 2 years of age should not recommend the albendazole. Mention the indication. Indications means the uses, where it is used. And as we seen in the this page of albendazole, when you click on this specific page, you will get, this is the indication. Indications means uses, where it is used: neurocysticercosis, then hydatid infection, ancylostoma, ascariasis, hookworm, trichostongylus, capillariasis, larva migrans, cutaneous trichuriasis, larva migrans, visceral, enterobias, fluk. Then there is gnathostomiasis, microsporidiosis. These are the indications of this specific drug. This is about the albendazole. We have the mebendazole, his brother. And what is the difference between albendazole and mebendazole? It is just the potency of the drug. In albendazole, we need 400 milligram single dose, and in the mebendazole, we need only 100 milligram single dose. So potency, mebendazole in 100 milligram is same powerful, acts, or we can say having the similar efficacy as of albendazole 400 milligram. So we can say which drug is potent. We can say mebendazole in term of the potency. So because it is need only 100 milligram, and in 100 milligram it will give the same efficacy of albendazole equivalent to 400 milligram. Same mechanism, it causes the degeneration of cytoplasmic microtubule in intestinal and the tegmental cells of intestinal helminths, plus it blocks the glucose uptake. This is the, in addition with the albendazole, it also blocks the glucose uptake. Adverse effect, headache, abdominal pain, dizziness, vertigo, nausea, diarrhea. And the contraindications are the same: hypersensitivity, liver cirrhosis, pregnancy, and children under 2 years of age. Albendazole and mebendazole. Ivermectin. Now ivermectin is generally under the investigational drug for the management of the COVID-19. Ivermectin is generally also given off label by the various physicians in the management of the COVID-19, but it is not approved one. Ivermectin, it is generally given to manage the COVID-19 infection. Ivermectin is a drug generally manufactured by the mankind pharmaceutical industries. Mechanism of action of this ivermectin: it binds glutamate gated chloride ion channels in invertebrate nerve and muscle cells, produces paralysis and the death of the parasite. So it produces the paralysis of the worm, and the worm is not able to form the intestinal wall, and or if it is not able to form the intestinal wall due to paralysis and due to the peristalsis movement of intestine, it will be expelled out from the body via feces. So it causes the paralysis and the death of parasite. Adverse effect: headache, abdominal pain, dizziness, vertigo, nausea, diarrhea, rash. These are the common and the general adverse effect. No, not the specific one. Dose is available 200 mcg. Mcg is microgram per kg. Mcg means microgram per kg PO once by the oral route and taken at once. Contraindications: hypersensitivity, pregnancy, and children younger than 5 years of age. So it is not recommended for the children under 5 years of age. So if the child, we have the patient of the 3 year old, we will consider albendazole or mebendazole. Now, yes, indication for the indications, ivermectin. Here, you have to come the main our page. Ivermectin. Look here, ivermectin, and just click on the ivermectin. You will be you will be landed to the ivermectin further reading, and these are the indications: strongyloidiasis of the intestinal tract. These are the parasitic, or we can say helminthiasis infections, river blindness, or we can say it is the onchocerciasis, head lice, off label, phlebitis, off label, filariasis, off label. Off label means these are not approved by the FDA for the treatment of the head lice, but it found useful in the management of head lice. Then there is a phlebitis, filariasis due to Mansonella, Ozardi, Streptocera, and the scabies. So these are the indications for the ivermectin, and you will get all the additional reading here in this left side corner. Click, and you will get all the readings. Next one is praziquantel. It increases the cell membrane permeability to calcium in cystosomes, causing the worm to dislodge following the paralysis of the worm muscles. So it's generally responsible for the paralysis of the worm muscles. And if the worm muscles are very important. Worm muscles are important to firmly catch the and attach to the intestinal membrane in the human. If the paralysis, the worm's muscle are weakens, and due to peristalsis movement of intestine, it is expelled out of the body through feces. Adverse effect: headache, abdominal pain, dizziness, vertigo, nausea, diarrhea, allergic reactions, myalgia, pruritus, and the rash common one. And the dose, it is available 20 milligram per kg by oral route 3 times a day for 1 day. And you can give also in the divided doses at the interval of 4 to 6 hours. Contraindication: same, hypersensitivity, we can say it is a common and universal contraindications for most of the drug. Intraocular cysticercosis, pregnancy, and the children younger than 4 years of age. So it is also contraindicated in the pregnancy and the children younger than 4 years of the age. Ivermectin is also contraindicated in the pregnancy. Uh, Mebendazole is also contraindicated in the pregnancy, and albendazole is also contraindicated in the pregnancy. So we will discuss in the therapeutics the most important drugs. Okay, this is about the praziquantel, and the for the indications of the praziquantel, you have to just come back on the your page praziquantel here, and if you click on the praziquantel, you will be landed to the further reading page of the praziquantel, and there is the indication schistosomiasis, and there is the cysticercosis. Generally, it is off-label used in the management of the helminthiasis. These are the commonly used drug, and for additional reading you can click on the drug and you will get additional reading. Next objective is classify anti-amoebic drugs according to the site and the mechanism of action. Here also, this PDF I made available functionally, and if you have to get the further reading, please click on the drug name for the further reading. Same. Now, classify the anti-amoebic drugs according to site and the mechanism of actions. Amoebiasis. Cis is a condition and which is caused by the amoeba. So amoebiasis is caused by the infection by the int amoeba histolytica protozoa. Amoebiasis is a condition which is caused by the amoeba int amoeba histolytica. Classification of anti-amoebic drugs according to site of actions. Asymptomatic intestinal infection, or we can say luminal amoebicides. These are the drugs are luminal amoebicides which kills the amoeba in luminal, and these are the diloxanide furoate. Diloxanide furoate generally not available in the United States, and that's why we have the another drugs: diloxanide furoate, iodoquinol, paramomycin, amoebic colitis and dysentery. When there is a now here in the asymptomatic there is no symptoms, and here in the when this parasite or protozoa, this protozoa when infect the tissue, generally the liver, it causes the colitis and the dysentery, and the most commonly used drugs are the metronidazole and tinidazole. And extraintestinal infection, uh, it also useful in the tissue amoebicides plus luminal amoebicides both, and this includes the metronidazole, and some antibiotics are useful: tetracycline, erythromycin. uh, these are the two antibiotics, tetracycline and erythromycins. Other drugs are emetine and the chloroquine. And chloroquine we studied in the topic of the anti-malarial drugs. So these are the, if we see metronidazole, it is generally used in the tissue plus luminal amoebicides, metronidazole and his brother tinidazole. from the category of nitroimidazole derivatives. If you click on the specific drug, you will be get the. Let us see one drug one by one. Mention the mechanism of action, therapeutic uses, means indications, and adverse drug reactions, that is side effects of anti-amoebic drug, paromomycin, mechanism of action, aminoglycoside antibiotic. It is from the category of the aminoglycoside antibiotics, and other the well-known drug from the aminoglycoside antibiotics are the streptomycin, neomycin, kanamycin, gentamicin, and this is the paromomycin. Aminoglycoside antibiotics interfere with the bacterial protein synthesis by binding to the 30S ribosomal units, and not the most important advantage of paramomycin, it is that not absorbed from the GIT, and that's why it is used in the amoebic infection. Now in the amoebic infection, the paramomycin is not absorbed from the GIT because we need the action on the gastrointestinal tract. Now we have less than a minute. This minute will be closed. So please join again with the same link. Okay. So aminoglycoside antibiotics, paramomycin. What is the advantage? It is not absorbed from the GIT, and this is the one advantage. We need the its activity to kill the amoeba at GIT. If it is absorbed to the blood, it will create other adverse effects. So that's why the paramomycin is used, because it is not absorbed from the GIT. Adverse effect: diarrhea, abdominal cramp, nausea, vomiting, heartburn. Dose 25 to 30 milligram per kg 3 times daily for 7 days. And contraindications: hypersensitivity and intestinal obstructions. Should avoid the use of paramomycin. If you click on the paramomycin here, you will get the additional information regarding the paramomycin.